So welcome to the final session of the symposium for this year. So we've had 3 sessions so far, which have been fantastic in terms of the different spread of presentations, but also the discussion that's happened afterwards. So today we have 4 presentations by 5 people. So Ella will go first, then Christina and Nikolai, Stacy, and then Tash. And then we'll have a discussion at the end. So that's an opportunity to ask each other questions. It doesn't necessarily have to be to the presenters. It can be putting a question out there for everyone as well. So we'll make a start. So Ella, if you would like to share your screen.
Can you see my screen now? Thank you. Thanks, Jess, for the introduction, and also thank you, Philip. I'm Ella. I'm a PhD student in the College of Education, Psychology, and Social Work at Flinders University, South Australia. Good morning and good afternoon, good evening, everyone. I'm very grateful today that I have an opportunity to present my PhD research about a nature-based naturalistic teaching intervention, the impact on joint attention behaviors of autistic children. Before continuing my presentation, I would like to acknowledge the cultural tradition of the land of the Kaurna people. I respect their elders past, present, and emerging. As we know, the prevalence of autistic children tend to increase in many countries worldwide, including in my home country, Indonesia. And in Indonesia, we are still struggling implementing inclusive education curriculum. And there are many autistic children live in rural areas, and it can be more difficult for them to access adequate services either in clinical or in educational setting. And we also know that difficulty in social communication is the core feature of autistic children, with joint attention as the more complex foundation of social communication development. Joint attention is the ability to share attention or interest about an object or an event with another person. As we can see from the picture that the father and the child, they both aware about the bird they are sharing together. So this ability typically emerge at the end of infancy, but in the autistic children, they may not present this behavior when they are 2 or 3 years old. So many research suggested that joint attention behavior is the early predictor of autism, and also suggested as the primary target of early intervention. Joint attention behavior is the dependent variable in this research, encompassing initiating and responding joint attention. So there are gaze look spontaneously by the children. So joint attention, it doesn't have to be making eye-to-eye contact, but gaze look is also the joint attention when the children also respond another person with looking at the person's face, and then also see gaze spontaneously or in response to other by looking at the person and then looking at the object they are sharing together, and then look back at the person again, and expression of emotion, initiating or responding, and then following a proximal point with eye gaze to the object, pointing by another person, and then following a distal point by moving their neck and their head to the object the person pointing on, and then directing point, initiating. And then also the very difficult behavior is directing attention by holding up, raising up, or showing the object in front of the interventionist or adult face. So this research aimed to develop a nature-based naturalistic teaching intervention and examine its effectiveness in improving the joint attention of autistic children. A nature-based naturalistic teaching intervention is a combination of the benefits of nature-based intervention and naturalistic teaching. I used a pine forest. This is located in my homeland in the central Java, Indonesia. We believe that nature provides a sense of relaxation that can help maintaining the motivation and enthusiasm of the children. So it can be a great opportunity for adults to train the target behaviors. And naturalistic teaching, there is a term of nature in the naturalistic teaching, but having different meaning. Nature in naturalistic teaching means following the child's interest and using play-based activity as the intervention procedure. And also during the play-based activity, the interventionist incorporates applied behavior principles like environmental arrangement when the interventionist prepared the environment and the material to ensure that there are sufficient opportunity for the children to initiate and to respond. And then time delay is implementing a waiting time for 3 or 5 seconds for the child to respond. And then verbal prompt, give the children a question, a statement, an instruction about an object, about the materials around them. And then modeling is giving an example by showing a gesture for the children to do something. And then reinforcement, I used non-physical reinforcement. So not a touching, but not tickling, but non-physical reinforcement like smiling, praising the child every time they show the target behavior. A single case experimental research design with multiple baseline design across participants was utilized to examine the effectiveness of the intervention. There were 3 consecutive phases, the baseline, intervention, and maintenance, along with 3 generalization probes during the intervention phase. Because this is a multiple baseline design, and to answer the efficacy of the intervention, so I implemented minimum 3 data points stagger between across the units of the participants. So the number of baseline and maintenance occasion are different for each unit. So this is the procedure of the experiment. In the intervention phase, the researcher was the interventionist, delivered the intervention for 12 meetings, each meeting for 15 minutes duration. The location was in the pine forest. And then during baseline and generalization probes, during baseline and generalization phase, the condition was similar. The teacher observed the participant during the recess time in 15 minutes duration. And in maintenance, the location was in green space as well, but the garden, not the forest. And the teacher and interventionist brought the child to play in the garden for 15 minutes, but without any element of naturalistic teaching at all. So there were 5 settings of nature-based naturalistic teaching intervention. There are walking along a garden, exploring the grass, playing with muddy puddle, and gardening activities. And we can see from this slide that this is a very amazing experience for me, that from the first picture, you can see when Zoe, the second participant, all the participants' names were pseudonym. And after giving 20 seconds for the children to feel the sensation of nature, Zoe at that time didn't respond at all. So I started attract her attention by singing and then pointing to some objects in front of her. And then she started looking at me with smiling. And then after that, in the third picture, we can see that I found a purple flower. I started the verbal prompt to Zoe, but she kept run away until she found some gravels, and then we played with gravels together, pick the gravel, and then put the gravel into the plastic cup. There are many amazing joint attention responding at that time. And the very amazing thing, when Zoe presented the very difficult one, she showed the twig in front of my face with smiling. So that was very beautiful. So this is another example of another participant. His name is Gary, and you can see Gary responded by approaching to the grasshopper on the grass, and then look at me, look at the grasshopper, and then look back at me, and then also showing the initiating behavior by pointing to something. This is very beautiful as well. And then this is the result. I have finished the data analysis with the Excel package of randomizing tasks 4.3 by Levin and Gavrov for the visual analysis, effect size measurement, statistical significance. But unfortunately, I can only present the visual analysis. But from this graph, you can see that during baseline and maintenance, there is no accelerating trend, and the trend is quite stable. But in the intervention phase, you can see significant accelerating trend for all participants, including for Zoe, who show the lowest increase of joint attention behaviors. And this is the validity and reliability measurement using inter-observer agreement, social validation, and research fidelity. For the inter-observer agreement with the independent teacher, the result is 80%. It means high agreement. And for the intervention fidelity, one expert watched 2 out of 12 intervention video recordings, and the result is 90%. So it means 90% of the procedure followed by the interventionist. So it means the fidelity is high. And for the social validation, I still finishing finalizing the result of the questionnaire. So that's all from me. Thank you very much for your attention.
Thanks, Ella. So it's great to see an intervention and have both the stories as well as your data presented. So thank you for providing. So next we have Christina and Nikolai.
Yeah, let me just see if I can share. Do you all see my screen? Great. Well, first of all, thank you for having us. I'm Christina, and I'm here to talk about our project. I'm here with Nikolai, my bachelor partner. We're here to talk about our project, Perceived Obstacles Makes It Hard to Enjoy Nature. It's a qualitative study of barriers experienced by people with mobility disability. The background for our project was these 4 key findings. For one, we know that nature provides some kind of health benefit. We also know that people with mobility disability is at a greater overall health risk. People with mobility disability is in our project defined as being unable to walk 400 meters without a brake or an aiding tool. We also know that people with mobility disability, they spend less time in nature compared to people without. But if we ask them 60% of them want to spend more time in nature. So we have this group in need of some health benefits, and they're motivated to go into nature, yet they don't get out there. So we wanted to investigate which barriers do people with mobility disability experience when in nature. We did some field work through Place Standard tool. We did it in a local specific area in Vejle in Denmark. We also conducted 4 semi-structured interviews, and we're going to focus mainly on the results from those, since they're going to be more representative. The results from the fieldwork is very specific to that area. So moving on to our participants, they were all male. They were between 20 to 60 years of age. They had either cerebral palsy, sclerosis, or spinal cord injury. All of them had somewhat successful experiences in nature, and all of them had somewhat high socioeconomic status, at least when it comes to network. All of them had a large group of friends or family willing to help them out.
Our results from our semi-structured interviews were these 5. The first one, maybe also a bit surprising for us, was the right attitude. According to our participants, they needed the right mindset or attitude before going out in nature. A negative mindset could lead to being less in nature. One said that we don't need to change the environment, change the attitude. We need to change the attitude of people with a mobility disability. The second one was show me that it's possible. 2 of our participants had experienced how other people have inspired them to start using nature. In both cases, there were people with a mobility disability who had overcome difficulties and through that experienced what the nature had to offer them. Third one was help. Our participants were sometimes in need of help because of unforeseen challenges, most of the time because of the design terrain. They also needed the right aids to get around. The fourth one was not everything can be planned. According to our participants, the use of nature was inevitably followed by uncertainties. Therefore, in the end, they must try to initiate and try to make the best out of it. The last one was the remaining 10%, which at least in Denmark, they said that there generally was good conditions for accessing the nature, but sometimes they met a few obstacles, such as narrow path, uneven ground, stairs, and steep terrain. These were the most common. And we did an analysis on our findings and did find 3 types of barriers. The first one was interpersonal, which was that our participants were in need of other role models before going out, other people to show them that it's possible. Second was intrapersonal, which was that they needed high self-efficacy or high self-belief in being able to succeed in nature. The last one was physical design. If there were some humanly designed paths or stairs or something else, it needed to be universally designed. And we did discuss in our group whether physiotherapists can help to improve self-efficacy when in nature, because this was the main barrier from our findings. And we discussed that physios has the knowledge to strengthen these people's physical functions, and they have they're able to take the interventions out in nature and make them nature-based, and through that have a chance to strengthen their self-efficacy. The problem is that most physiotherapists lack the knowledge of where to go and what the health benefits are in nature. At least we think that it's not a huge part of the education, nature-based interventions. And also the second problem was that documentation that we are expected to document on things like increased range of motion or increased strength. And the problem is that these are not the main goals when going out in nature. So there's a gap between what we are supposed to do and what the benefits could be out of nature.
So we also discussed how can physiotherapists then help to overcome some of these barriers when in nature. And a seemingly low-hanging fruit would be to facilitate a space for people with mobility disability to meet and share their experiences, some with nature experiences and some without. This could be through nature-based intervention, but it could also be just to facilitate a space for them to meet. Yet one problem is that such an initiative already exists in Denmark, yet we as physios didn't know about it, and our participants didn't know about it either. So even though there are some initiatives out there, we just don't know about it. So there's some low-hanging fruit for us as physios to just be able to pass on that information about such an initiative. That initiative is called Frontløberne, which translates to front runners. Another low-hanging fruit would be for us as physios to have a better grasp about specially assigned aiding tools. One example would be the jogger, which is like a terrain-going wheelchair. One of our participants used that to travel the whole length of the Camino in the wheelchair. So there's seemingly some low-hanging fruit for us as physios to help overcome these barriers. Yet the problem is, once again, the lack of information. We don't have enough knowledge about nature and the benefits, and we don't have enough knowledge about initiatives that could share inspiration. So that brings us to our conclusion, which was that intra and interpersonal barriers are perceived as greater barriers for people with mobility disability than the physical barriers, and they shouldn't be overlooked. So it's not just about steep terrain and narrow paths, it's also about their attitude towards and their experiences in nature. We also concluded that physiotherapists can help to overcome these barriers through nature-based intervention and facilitation of sources of inspiration, but that it requires more knowledge about nature. This could be through the education, like the basis physio education, but it could also be through special courses and stuff like that. Moving on to perspectives, not only like if we succeed in getting this group of people more into nature, not only could it improve health status, it could also help to decrease the inequality of health, because we would take a group of people with a lower health status and help rise it. But also, as mentioned early in one of the other sessions, you protect what you love. So if we get more people out into nature, there's a potential for them to show more pro-environmental behavior and protecting it a lot more. So yeah, some great perspectives. And I think that was it from us.
Great work. Sorry. It was lovely to see you presenting different perspectives or different approaches to physio. So you've got your kind of traditional strength-based stuff and then actually doing it in nature and then thinking about the other resources that might be available. So excellent work. And so I think it's great that we've had a couple of student presentations. So Ella doing a PhD and Christina and Nikolai with their bachelor's project. So it's great to see the next kind of generation of health professionals coming through being really interested in this. So well done. Next we have Stacy. So if you want to share your screen.
Okay, fantastic. Thank you so much to all the speakers who have gone before, and thank you for having me here. And I'm so happy I have to shout out Sybil, who many of you know from St. Lucia, and I think I saw Sergio from Suriname. So I have some support for this presentation. So I'm just here just to break free a little bit from the traditional type of research presentations, just to give a Caribbean perspective regarding plants and physiotherapy clinics in the Caribbean. And just for information's sake, I hail from the most southwestern country in the Caribbean called Trinidad and Tobago. So all of you are welcome to visit when you're ready. You won't have to pay for any hotels. You'll be able to stay with me. So the Caribbean is generally known for its sun, sea, and sand, but we are much, much more when we are speaking about that environmental sort of perspective. The Caribbean is considered to be a biodiversity hotspot with lush, vibrant landscapes and greenery. Now, despite our total size being quite small, our extraordinary botanical biodiversity is comparable to that of Madagascar. Many of our islands were formed due to volcanic eruptions, and some, just as Trinidad and Tobago, we broke off from South America. So our flora and fauna is quite indicative of what you will find in the Amazon. So it gives you an indication of the variety of flora and the variety of our biodiversity in our small region. However, there are clear signs of decimation and permanent loss of our vast diversity. And this began centuries ago due to colonial agriculture, and which continues today because of increased populations and, of course, the development of industry. So, for example, Trinidad and Tobago's main income is that of oil and gas. So you are getting a picture of what our environment looks like. However, despite all of this, there is a constant link and reminder of our connection to plants. Plants are more than just decoration for us in the Caribbean. Sometimes we do take it for granted that we are surrounded by beauty, but plants form part of our healthcare traditions. For centuries, our indigenous people, our Afro and Indo-Caribbean communities who arrived to our shores through slavery and indentureship have used and relied on medicinal plants to manage a wide range of medical ailments. We now each live in a time of modern medicine, but many persons still rely on plants which have medicinal and cultural significance for us. Aloe vera, for example, which is pictured here, is still used in its pure form to soothe burns and ease skin conditions. Soursop, which is a tropical fruit that makes delicious ice cream and smoothies. Its leaves are used to manage high blood pressure and to ease the aches and pains with those undergoing treatment for cancer. Lemongrass, for those of you who cook, very traditional plant used in Asian type of cooking, but we also use it for teas. We use its leaves to produce oils that are used for its calming and relaxation effects. So for me, growing up in the Caribbean, plants have always been part of our conversation when it came to health, as many plants provide relief to ailments and, of course, continues to connect us to our heritage. Now, I just want us to look at this picture for a moment. I didn't cook any of these, just by the way. And I want you to look at these two bowls. So they are bowls of soup, of pea soup. I wonder which bowl of soup you would choose to eat just by looking at them. Would you pick the one on the left? Or would you pick the one on the right? There's always a saying for those of us who love to cook. I am an amateur chef. We eat with our eyes first. And this small experiment, and I hope you chose the bowl on the right, this small experiment serves to remind us about the value of aesthetics, that things of beauty awaken our senses and encourage us to respond in positive ways. And it is, of course, one of the more obvious values of using plants in the Caribbean. for its aesthetic value. Our major role as physios should be focused on improving the well-being and quality of life of our patients. Of course, we have an extensive array of tools that we use to satisfy this goal. But sometimes we are so focused on getting things done that we are not always in tune with the vulnerability and stressors that patients experience as a part of their injury or illness. Thankfully, just the simple sight of greenery can provide a sense of calm and reassurance. The Caribbean's rich palettes of tropical plants, the pothos, the ferns, the orchids, the heliconias, and that picture in the background is called the bird of paradise, and it falls under the heliconia family, brings color and life into what might otherwise be a very sterile and cold environment. And as such, some of our clinics embrace the concept of aesthetic healing, using plants to enhance a space and to induce a sense of well-being. This picture here is just a little Buddha with some plants around that actually forms part of the entranceway to one of my clinics in Trinidad. And I just want you just to take a few seconds looking, whether you want to look at the Buddha head, whether you want to look at the plants. And you realize when it calms you, it says, oh, it's so cute, it's lovely, your breathing pattern changes. This is the value of aesthetics and the power of plants that we need to continue to embrace in the Caribbean and far and wide. This is another picture actually showing the driveway to one of my clinics. So the background has palms. This is another plant that is sitting just under the sign of the practice. And of course, I don't have to preach to the choir, but remember that aesthetics and the research has shown reduces stress, promotes a sense of well-being, and it also increases that a level of environmental consciousness. The beauty of plants, and even artificial ones, so even if you're in the cold and plants are not growing, even artificial ones promote improved levels of environmental consciousness and promotes that reduction of stress. And the great thing about living in the Caribbean is that even if by accident, most of our clinics are surrounded by plants. We all would have been exposed to in school the role of trees and plants being the lungs of the earth. And that's, that balance between the production of oxygen and the absorption of carbon dioxide. So there should be no surprise when we know that there's some level of value with regards to the use of indoor plants for improving air quality. And of course, one of their most important roles is the removal of nitrogen dioxide and VOCs within the environment. I say this, and I say it with some level of caution, because the research shows that even the presence of indoor plants is not sufficient to make a significant change in the air quality of households. However, if you speak to persons who live with plants, they will tell you that they have decreased allergies and improved sense of breathing. So, sometimes there are things that might be statistically significant, but practically you might see a difference. Now, be that as it may, there are some Caribbean and tropical plants that are quite versed in the extra production of oxygen. And some of these are pictured here: the snake plant, the ZZ plant, the dumb cane. These are just a few examples. But my favorite plant here is the snake plant, and I'll tell you why. The snake plant continues to produce oxygen even at night. So if you remember your science from school, you find you have more oxygen production during the day. But these plants, especially the snake plants, continue to produce vast amounts of oxygen at night. They are very, very low maintenance, don't require a lot of work, a lot of water. So you could forget a snake plant for weeks and it's still going to be beautiful and still produce extra oxygen in your indoor space. And can I just give you just a quick little, well, I think it's funny that the snake plant in the Caribbean is also called mother-in-law tongue. Yes, I don't know how many of you have mother-in-laws that you may love to death, But you know, sometimes the mother-in-law has a very spicy and sharp, long tongue. So this is why the snake plant in the Caribbean is also called the mother-in-law tongue. Just something for you to think about. Now I'm preaching to the choir, but this is a reminder that the inclusion of plants can have much more than a calming influence. And our studies show the vast role of plants in increasing alpha waves in the frontal lobe, increasing parasympathetic activity, decreasing skin conductance, decreasing pain intensity, decreasing our diastolic blood pressure, decreasing heart and respiration rates. And it's important to note that even the addition of a simple plant in a sterile space has physiological impact, has physiological responses. And this room is a room that I share in my practice with a medical doctor. And it's, you know, very clean lines. And just that addition of that plant made a change in the feel of the room and the impact that the patients who traverse that room would experience. So this is another picture of part of one of my clinics. I tend to like bright colors, but an awareness of the benefits of green spaces is increasing. And more Caribbean offices are embracing the idea of incorporating plants in their design. This only serves to create spaces and clinics that are both functional and healing. And our rich biodiversity allows endless possibilities for plant integration into our clinical environment. So hopefully we will see more trends in incorporating biophilic designs, and that is incorporating elements of nature into built designs. So these are just some pictures I wanted to share. And these are ways to, you know, have that biophilic design, as simple as adding a potted plant. So the first picture is an orchid in one of my waiting areas. The second, another orchid, because orchids are really durable. You don't have to do a lot with them. They don't need a lot of watering. That's another waiting area of one of my clinics. The third picture is one of my colleagues. She's a medical doctor who has a whole heap of plants. And it forms such an important part of her practice, which is actually called the healthy living practice. And it's a, you know, conversation piece for her patients, even when they get in, so that they're more comfortable and it's easier to deal with them as a client. Some more pictures of the use of plants in some of our clinics. And incorporating plants in the Caribbean is no longer just a trend, as I mentioned before. It's a return to something deeply rooted in the cultural and environmental landscape of our region. Let's use nature a little more. Remember, it doesn't have to be a real plant to get the same benefits. To create spaces that nurture the body and the soul. And for me, as a Caribbean PT, plants serve as a powerful, powerful reminder of the natural forces at work that foster healing in moments of care and recovery. So I hope that I've stayed within time. I thank you for this opportunity. That's just a picture of what the Caribbean looks like. Again, you're all welcome here. And hopefully we as Caribbean physios will continue to embrace our environment a little more, not take it for granted, because the benefits of plants for nature and nurture are undeniable. So thank you all so much.
Thank you, Stacey. So lovely presentation again, and yeah, the photos. I think you've sold us all on our next travel location. You provided a great idea of how we can actually incorporate both outdoor and indoor. Yeah, so thank you. And then finally we have Tash.
Oh, thank you so much. I'll share my screen here. Da-da. And do you see the right view on this one, not the presenter view? Beautiful. Thank you so much for the opportunity to speak here. I was intrigued to hear all these presentations. It is really cool to hear the other work going on in this area. So I work as I'm co-director of the Impact and Health Centre at University of South Australia, and I also lead the Persistent Pain Research Group at SAMRI, which if you ever come to Adelaide, it's a big cheese grater building, a bit of a talk of the town. But I want to speak to you today about basically our venture in using virtual reality cycling, but having it so that the virtual environment is actually capturing nature and using that to enhance exercise experiences and engagement in people who have osteoarthritic pain. So as a physio, I think I'm always pulled towards trying to get people to engage in healthy movement. And this is challenging sometimes because, of course, we know that as a society, we don't move enough, and it tends to get worse if we hurt. So the World Health Organization, for example, their data suggests that only about 1 in 4 adults actually meet exercise recommended guidelines of 150 minutes of moderate to vigorous exercise per week. And if we look to populations that have chronic pain, we see that this does get worse. So it's only about 1 in 10 people who have painful knee osteoarthritis are actually doing enough activity to maintain their health. And I mean, of course, the big question is why? And there's a lot of contributing reasons to this. But one of the reasons I think that we've been particularly interested in is how people actually feel during exercise itself, particularly because that has been shown to have a very strong ability to predict their future exercise behavior. So that if it feels rather crappy when you're doing it, you're going to be less likely to do it again. This supports the idea of hedonic theory. We do the things, more of the things that we like to do and that feel pleasurable to us. And so the challenge then, I guess, being is that if we think about exercise for people who have chronic pain, it often isn't as pleasurable. It often does hurt, particularly at first. And sometimes if they've become deconditioned or, just haven't done very much, it can feel overly difficult or effortful, making it a not very enjoyable experience. And so we've really taken the route of, well, perhaps if we can enhance exercise experiences themselves in an individual, then they might be able to have important influences on what they choose to do in the future, so their future exercise behavior, but also might improve their engagement with effortful interventions. And that's probably one of the biggest challenges for chronic pain is that many of the interventions with the best evidence and that are recommended by all guidelines actually involve aerobic or strengthening exercise. They are they require effort to engage in. And so we know if we can help people to engage more with those types of interventions in the longer term, that does have impact on reducing pain and improving function. So in this, we explored whether technology like virtual reality might be something that could actually enhance the exercise experience. So we did our good due diligence as researchers, and we did a scoping review. And this was led by my master's student at the time, Brendan Moat. So we looked across the literature to see how and what is being used in virtual reality to help enhance or make exercise feel better. And we really found there's a variety of strategies used in healthy individuals, but there's been very little research in any clinical population and very little at all in the field of chronic pain. But one of the things that kind of came out to us, well, first of all, it identified, that's a gap for us, and we could probably look to fill that gap. But within our review, we also identified a couple of studies that were looking at the impact of exercising within a nature environment. So whether that be real or whether that be, made through a virtual environment, and showing really promising effects. So when we looked more generally at the literature for nature and exercise, there's some evidence to suggest that when you're exercising in a nature environment as compared to indoors, you actually have reductions in your perceived exertion. You feel like you're not working as hard, even though you're working at similar intensities. There's also some evidence that actually when you're exercising in nature environments, it promotes your engagement in more vigorous physical activity relative to indoor environments. And generally, there's really lovely effects on stress and enhancing mental health when you're exercising in nature environments. And it's been postulated that this particular theory, the attention restoration theory, is that nature environments can sort of, they word it, elicit restoration from mental fatigue by giving you this form of attention that you're not requiring effort to elicit. It's this idea of kind of like fascination and a sense that you're actually being taken away from your everyday problems. And so we were really interested, like, this seems really cool, really promising. Can we create a virtual reality exercise intervention that actually uses this premise of nature? So this is the virtual reality bike that we created. So basically you're sitting on a stationary bike, it hooks up to a cycle ergometer, and that ergometer basically communicates with this VR program that we wrote, so that as you cycle, that's sort of determining how quickly then you're going through this virtual environment. And we tried to create it so there was a lot of green space, lots of trees, really blue sky, and you're going through a variety of different landscapes. And so this one, we tested this in healthy volunteers and saw really promising results where we could see that if we varied different things of this virtual experience, we could actually change how good or bad they felt while they exercised, as well as change how hard they perceived themselves to be working. So that we felt was very promising. But one of the biggest challenges anytime that you're looking at interventions is that there's often a disconnect between what we test in the research environment and what we might actually be able to use in a clinical setting. And so we were fortunate enough to receive some funding from the Hospital Research Foundation group to purposefully adapt our research version to something to take into the clinic. And this was work that was led by my PhD student, Erin McIntyre, and a postdoc from our lab, Dr. Jim Saradakis. So as part of this, what we basically did is we undertook a co-design process where we adapted our system with end users. So the end users for our study were people who had painful knee osteoarthritis, as well as physiotherapists. So we undertook a first phase where we did lab testing, where we got the end users to come into our research lab, and we let them experience the cycling intervention. We had feedback from them through open-ended questions as well as interview, and then we adapted and updated the VR bike based on their feedback. We then undertook phase 2, where we took that adapted bike, put it into a physiotherapist clinic, and then they, as physiotherapists, were trained to how to use the VR, and they provided the intervention to people who had painful knee osteoarthritis. And again, we garnered a bunch of feedback, suggestions, things from this process, and then updated the VR bike. So we ended up with a product that looks a bit like this. So a person's riding a bike, they wear a head-mounted display, so video goggles, but with all the feedback from all the participants, we designed individualizable resistance levels so that you could change resistance as you're going, but you could also just go on different levels, kind of like easy, medium, hard. We also found that if we manipulated a little bit the speed at which you saw the environment go by, if we made it just a little bit inaccurate, it doesn't feel bad. You don't feel sick. You feel awesome. You feel like, I am smashing this. So we created this little ability to just adjust the speed for that person so that they would kind of get that feeling that they're really doing well. And we also created lots of different features of the VR environment. So we added in animals, we added in birds, we added in like bridges that you can kind of scoot under, and it's like an animal a tunnel. And then we also added in different environments. So you can see there in that picture, you're transitioning from nature to a city environment. So we tested this bike. Our first question was just from immediate effects, does using this VR cycling intervention exert a benefit beyond cycling alone? And so for this, we recruited 25 people with painful knee osteoarthritis, and each of those participants undertook one of 2 conditions in a randomized order and about a week apart. And that was either a VR cycling condition or a non-VR cycling, so just no headset, they're just doing normal cycling. For this, what we had them to do is they went at a self-selected cycling pace. So they chose how hard they're working. And we told them you can go for as long as you like. It's a maximum of 30 minutes, but stop whenever you feel like it. And we use that as a measurement of exercise engagement. And so this is what we found is the blue on the left, that's the VR bike condition. And the first graph is just showing that when using the VR cycling, people experience significantly greater enjoyment of the exercise experience relative to just traditional. And then the second graph is showing that actually they worked harder. So when they were using VR cycling, they worked significantly harder than when they were in the non-VR. We also found that it enhanced exercise engagement. So when using the virtual reality cycling, they chose to exercise for longer, and it reduced their pain relative to the no VR cycling intervention. So as a physiotherapist, this is a dream. We're seeing that virtual reality cycling means that people with NeoA hurt less and enjoy the exercise experience more, despite working harder and choosing to cycle for longer. So we now have followed that up with a feasibility randomized control trial where we've taken 40 people, but we've randomized them either to one or two groups. Again, the VR cycling group or the no VR cycling group. And this is a prolonged treatment over 6 weeks where they get 2 sessions a week. So they get a total of 12 sessions. Again, same instructions, go for as long as you want at a self-selected pace. And we found really positive results. So we look at a lot of different features of, is this feasible to do? I don't expect you to read all of those, but for example, people found it acceptable and credible. We were able to recruit people quite quickly. There was very few technical difficulties, which is really positive. But perhaps most importantly, we also found significant and clinically meaningful reductions in knee pain and improvements in physical function. And the analyses that we're actually undertaking at the moment that I was so hopeful we'd have them done by this time, but we're comparing how people were feeling when they were in that city environment relevant to the nature environment. So keep in touch with me and I'll let you know the results of that. But to summarize, I would argue that we can't expect that telling people to move more will work. We need to enable people with pain to undertake exercise, and exercising in nature environments has been shown to improve both the exercise experience and benefit mental health. And perhaps virtual reality, using these virtual nature environments might help play a role in making exercise feel easier and more enjoyable, but also making it accessible sometimes for some people that may not have access to green space close to where they live. We found that this speeding up of the optic flow, the virtual reality going behind you was enjoyable and seemed to work. And using these types of interventions may help improve that engagement in exercise. So on that note, thank you so much for your time and your attention.
Thanks, Tash. So another great presentation, and I think we were talking before about how across the 4 sessions, the presentations are really varied, and that's another example of something that we haven't seen, which obviously is relevant to physio. So thank you for that contribution. So now we've got some time for a discussion. So if anyone has any questions or things they would like to share, the floor is open. So Philip.
Obvious. The question, always have a question, but I really just wanted to say actually to the speakers of this session, it's so great, I mean, this is, as we said, the 4th session of the day. It's amazing the range of environments we've covered throughout the day. We've gone, Dave Butler in the first session, he took us through, even just imagining natural environments in our heads to in clinics, outside of clinics, and forests and cities and parks, and to virtual environments. It's really, really cool, to see how broad this field is and sort of what broad potential also there is to think through this field. I'm at risk of sort of like at the risk also of being kind of asking the obvious question. I want to go to Tash first, and a little bit about this sort of VR stuff. I'm probably for sure I have some kind of bias of just thinking this kind of, yes, but why the VR goggles and why not just outdoors, right? Like, because I would argue there is additional resources that come into play when we work with VR goggles, and so I understand that, like, from what I understand, essentially, am I right to assume that this is a stationary bike that, yeah, okay. So, and then you're comparing that to a standard stationary bike in a kind of training environment or something of the sort, or
So it's
so that
the exact same bike,
same bike,
just you're not
with,
using
yeah,
the VR.
okay, got
Yeah.
it. And so the
Yeah.
thing I'm wondering is, you know, but with this optical flow thing, actually, much more so, I'm just wondering, and kind of maybe you can postulate if you have any kind of like sense of what direction this might go, but is it possible that there might be a surplus value in the VR goggle because you can do that kind of thing, like increase the optical flow, which kind of gives that extra like, wow, I'm doing so much better than I would expect, which maybe you couldn't get if, let's say, you walk through the park, through a park, an actual park, and you experience your struggles of walking through the park much more because it's at kind of the pace that you're struggling at. Do you know what I mean?
Yeah, and
Yes?
look, that's a really good question, because I think, and that is exactly why we think that this has possible benefit. I don't think that cycling or exercising in a virtual nature environment is better than your ability to do it outside. I think
Yeah.
actually being in nature will probably always be superior. The challenge is kind of exactly what you allude to. Sometimes if we haven't done things in a while, we're a bit fearful, we, have become deconditioned and unfit. Sometimes you go out and you try to do that in a real environment, and actually the barriers end up being big. It's not an enjoyable experience. And you're like, I don't want to do that again. That wasn't fun and that was a bit stressful. And so I guess what we're trying to do is, particularly in people who haven't moved very much, it's like getting them over that hump of and that barrier, even if it's like a mental barrier of being able to do that. And we're trying to use those different features of VR to like enhance and make that as enjoyable as possible for them. So even if it's not quite accurate to their physical effort, we're giving them the experience of achievement. One thing I didn't mention, and it was a beautiful suggestion from people, is that they asked us when they said, when we're going to stop, it would be really nice if we went over a finish line. So we created this feature that when people said, oh, I'm getting tired, I want to stop, we press a button on the computer and this big finish line emerges. So it's things like that I think you're bringing in other concepts and other features that you can make that so that it is enjoyable. And I think then, like as an example for our prolonged study, many people bought bikes after they were done and they started to cycle outside, and they just said that wasn't something I would have tried before because I didn't think I could do it, and it just felt too risky. And so I think there's real merit in, maybe this isn't for everyone, but it is maybe that key resource to be able to undertake in people that are having trouble exercising. Another feature that we've been really interested in, and we haven't looked into it fully, but immersion itself, so being immersed within a virtual environment, we also see changes in people's arousal levels. So we're getting differences in things like heart rate variability. You're getting changes in your like skin conductance responses. So the whole physiological response to things is potentially shifted when you're undergoing immersion. And we need to still do a lot of different control experiments. Like right now, we chose the just traditional cycling because that's what's done clinically. So we just wanted to have a clinical comparison. But I think we need to compare to when you're not immersed, when you maybe just have a screen in front of you. We might want to compare our VR when you don't have that speed gain on versus when you do. So all of those little comparisons, it would help us understand what aspect is contributing to what response.
Thank you. So Christina?
Yeah, I was just thinking that like in our project, a common found was that our participants kept on saying that they never knew it was possible. They never knew they could actually do it. And then once they discovered that it was actually possible, they started doing it more and more. So I'm just thinking like, oh man, if we could introduce VR to some of this group in our project, like people with mobility disability, and teach them that it's probably not impossible, then maybe they'd get out there more. That could be another source of inspiration for them. So that was just, yeah, something I thought about.
Yeah, that's great. And I think it's one of those things that can be implemented if you're in a position where you can't take people outside. So you can actually be there to support them and talk them through, you know, pain's okay and those kind of messages. If your insurance doesn't cover it or you're not near a space that you can safely ride and things. Yeah, so it's a great introduction, as you said, Tash, to actually getting people to do it themselves once they realise they can. Ms. Barnson?
Yes, hello. Thank you for the presentations. But I'll ask questions about what I don't know a lot about, which is VR. Although I have questions for everybody else, but you know, I don't want to hoard the whole thing. Is there any way to improvise? Yes, virtual reality as you've had it, because I'm guessing that those goggles don't come cheap. So let's say what has become, you know, physio now, like an indoor gym, people are cycling. How you know you can improvise, and also I was wondering whether there was, aside from green space, I don't know whether your project did that only, or there's a term I've learned now, blue space as well. Like, is there any virtual reality thing that is about water, maybe swimming or something? And I'm curious about that because of hydrotherapy. Is there any research or evidence that says that, okay, just by being in that environment, they can do similar? I don't think it can be the same, but like a similar effect, the principle behind hydrotherapy, like they're able to do more. Yeah.
Yeah, really good questions. In terms of, I'll maybe go to the improvise question first. So being able to take some aspect of it. So you're right. I mean, the headsets are becoming better priced, but they're still, I think the cheapest one that I've seen is probably about $500. That is the ones that would support a program like this. So that is a barrier, I think, right away. What you can do is you can get Google Cardboard, which is, I think you can order them and they're like $10 or something. And you can put then your smartphone in the Google Cardboard. And there's YouTube videos that basically have like binocular vision. So they've gone and they've explored different nature environments and they just present it on the YouTube video as two pieces. And that's how VR goggles work, is they show the same thing to each different eye, but slightly tilted so that it looks like you're immersed. So what you wouldn't have is you wouldn't have the nature scenery matching someone's effort on the bike. But what you could have is nature scenery where they're pedaling on the bike and it's almost like they're using it as a little bit more of the form of distraction, where they're looking around, looking at the different nature, but then they're not seeing kind of a gym wall that, although if we're going to Stacy's gym, it sounds amazing because there's plants everywhere and it looks incredible. So that one excluded, but that might be a really useful tool. I know they have done a version of that where they had people wearing the Google Cardboard and they had them walking on a treadmill. They did have them like with a harness because I mean, it's amazing how quickly you forget what your real surroundings are when you have that and you're seeing that in these virtual reality goggles. But that's one way that quite relatively cheaply you can try some of those different things. So you can I just Google like YouTube videos for Google Cardboard nature, and there would be ones that come up. In terms of blue space, that's intriguing. I've not seen that at all. I've not seen that being used. I would anticipate that with hydrotherapy, there would be many quite specific benefits of the water itself that I don't know that you would get necessarily if you were using the VR goggles outside of water. But again, it might be an aspect where people are really fearful of going into water, and that could be the transition phase of like practicing doing movements where you're seeing, even just in like using YouTube videos of underwater and practicing doing that stuff. And that might be something that might help shift. Oh, Philippe, yeah, tell us about your experiences. I'd love to hear it. But yeah, so I think that, yeah, a lot of that stuff, we're quite in the early phases of understanding how to use this stuff clinically, merely also because the price was, I think, prohibitive at first, and now it's getting much better.
Yeah. I mean, I've seen like kind of this virtual blue space exposure or immersion in the context of an expedition that I was on a couple of years ago or a few years ago to the Arctic that was about deep sea exploration, and then kind of blue space immersion was used also, you know, kind of virtually for science communication, science education purposes, but also then there was like these little kind of mental health implications and explorations in there. So I know it's been going on from a lab in Italy and for a while now. But I had another kind of another question. It's been really interesting throughout the day, actually, if kind of to review. We've gone really in a kind of full circle movement. Also with regard to physiotherapy as a profession, because we started the day with perspectives on how nature-based health and therapy have been a thing for indigenous populations for, you know, eons, if you will. And Stacy has kind of, you know, underscored that again in her presentation. We then also went through a kind of history of physiotherapy presentation where Glenn Rusko really made evident that physiotherapy has its roots in nature-based health and therapy, you know, using kind of natural, using just air, water, you know, heat, whatever, and so forth, right? And so what I'm struck with is that we're in this moment, and I think among us here, we're in this bubble of people that are kind of like really re-emphasizing some of this, but maybe in a slightly different way, a slightly new way, but also by way of, you know, plants re-entering the clinic, which have left the clinic for a while because, you know, for all sorts of reasons, you know, hygiene, legitimization of the allied health professions, et cetera, et cetera. And now we're bringing them in because we realize, oh, actually, you know, there's huge health benefits and all sorts of reasons to do all these things. And so it seems like there is something really great happening. But then I'm wondering, and this is actually a question that's to Christina and to Nikolai. You guys have finished your bachelor's. You've been really excited about this topic. I'm not entirely sure what you're doing now. I've followed you through this project, but I'm gonna guess that you might be in clinical practice in physiotherapy. And I wonder, from that enthusiasm and the sense that, oh, something is happening, we're doing some nature-based stuff. Now you come into clinical practice. Is it there? Are you experiencing it out there? Do people know about it? What's going on, you know, like in the field, and especially sort of like from your perception as a student coming into the clinical field, if that's where you are actually. Yeah.
So I'm working in a closed psychiatric facility, actually. And we have a garden. It's not that big, but it's there. And I try to bring my patients out there as much as I can. But my experience is that I'm the only one really trying. Bear in mind, I'm the only physio at work, so my colleagues are nurses. So they have other stuff to think about, medicine, for example. I find it hard to, well, the hospital I'm working at is very, very close to the water. And some of the patients I get to take on walks, and we can walk by the harbor. And I've managed to get some of the patients to go swimming with me, which has been awesome. There's also a kayaking club, and I'm looking at that very, very intensely every time we pass it, but I just haven't had the time yet. So I find that it's actually time and more of the organization being the barriers for me to actually have the time to facilitate nature-based interventions. Yeah. As for indoor plants, we don't have any because it's a matter of safety. We can't really have lose items that are heavy and stuff like that. Yeah, but we do have pictures of nature.
That's great. And I think although you're identifying some barriers, you're doing really well by the sounds of it in terms of incorporating this already into your practice. So well done. Nikolai, what about you?
So I'm working at the same hospital as Christina, but in the orthopedic. So it's most of the patients are coming in and getting an operation and leaving after a few days. So we don't have the time, and the patients don't have the what do you say, the physical function to go outside. So for my job, I don't think it's possible. I try to implement, say, to the patient, when you get home, try to do stuff, but I think it's only on me. I haven't heard any one of my colleagues mentioning something about nature and physiotherapy, so I don't think it's common to take that into praxis. I don't think so.
Except that, as you're just saying, the only and primary goal of all of your patients is to get out.
True.
Yeah.
Most of the time to their own home. So.
Well, yeah, but you know.
Okay.
Yeah.
So there's a question for both Christina and Nikolai in the chat from Sean, just asking about the fact that all your participants were male, and your thoughts around the barriers and so forth for women, and then also asking about pediatrics.
Well, we wanted both genders. It was just a matter of what we could find, I guess. It was a bachelor project, so we only had 12 weeks. So it was by coincidence that they were all male. Yeah. And then about pediatrics?
Wondering what work has been done talking to children and families with disability and how their perceptions of nature access, especially since the benefits of nature in child development. So did you find anything in your reading and so forth around kids?
No, we didn't focus on children, no. It was 18 to 65, I think, was the age group we were targeting.
Yeah. So I can actually answer that second bit a little bit. So we've got a systematic review that's half done at the moment, which is looking at people with disability and their access to nature. And there has been some work done with children and families. A lot of these were from memory, because I haven't looked at it for a little while. Families where the child was in a wheelchair, and there were some really interesting barriers that came up that we hadn't thought of. So we were looking specifically at barriers and facilitators. And even things like having any bumps in the paths being something that could be really painful for the child, and therefore something they tried to avoid. But then there are a number of papers about people who are vision impaired and they need the bumps for locating where they're going and things. So there's, I think, these competing issues around different types of disabilities and trying to incorporate spaces that everyone can access. And probably there's not a way to actually do it in a, that everyone can access every space, but trying to think more about that from a bigger picture perspective, making sure there's a space that everyone can kind of access. So that's something that, we'll get back onto now that teaching and things out of the way. Early next year, we'll get that paper out. I think, Philip, you're next.
Yeah, I have a question for Stacy, actually. Stacy, I wonder, it's still a question for me about, how much are we maybe seeing some of this in physiotherapy clinics, if you will, around the world. I think, with Christina's and Nikolai's study or the bachelor's project, it was about access to natural environments. Whereas, of course, what you've presented is a little bit on the other side of access, right? It's about bringing nature in and kind of, it's sort of almost reversing that access logic a little bit, how to bring nature to people as opposed to people to nature. But then I'm wondering, because you have a role in, I know you have a role in the executive board of World Physio, right? I'm going to assume that you've traveled around the world a fair bit and maybe seen clinical environments around the world. What's your impression there? Are Are there plants, pictures of plants, etc.? Is that a normal thing or is it not a normal thing?
In all honesty, I see more incorporation of plants in the tropical areas. So not just the Caribbean, but recently we were in Bali for the Asian West Pacific Congress. And their practices embrace that concept because, again, it's part of the environment. Some places in Florida, because, again, of the climate difference in New York, where you'll have the use of pictures versus the use of actual plants. But in Florida, you'll have more actual use of plants. So it tells you how much, not only in plants and in every sphere of our practice, how much nature dictates how we, shape our practice without us even being consciously aware. So, for example, Christina mentioned a while ago, and I'm sure it's a thing in many countries, the safety factor of having loose objects in a practice. And be that as it may, there's always an irony here when you look at all the other pieces of equipment that could be also deemed to be loose, but scattered all about. You have IV poles here, you have your electrical stimulation machine cord hanging there. So I think it's come to a time where we have to change perception to a degree, and again using the whole concept of biophilic design, so that when you build you build in your nature into your physical structure, there'll be less concern about safety, because that will be part of the consideration in designing your clinic. And again, but what must be important to know that even the artificial plants have powerful effects. So those 2 plants that you saw in my clinic by the bicycle are actually artificial plants that everybody thinks are real, because a lot of people have that in their gardens at home. So it still has that effect. So it's just an interesting look from country to country. Some of the colder areas, some people use plants because the older physios did more outdoorsy sorts of things, and you find a lot of the younger clinics run by younger physios, they don't embrace it as much because they're more in tune with computers and driving and that sort of thing. So it's culture and experience motivates everything, including how we use plants in our clinics. So I hope I gave a little added viewpoint to what you've asked, Philip.
So Sergio?
Hi, everyone. I just wanted to mention one of the barriers that we sometimes face here in Suriname when trying to bring patients outside. So one time as a physio, we had a meeting with the health insurance companies, because they wanted to talk about the endorsements and how physiotherapy is being provided in Suriname. And one of the health insurance companies members said, we don't want our patients to come for physiotherapy under a tree. So we want to see the clinics and how well the clinics are equipped. And that struck me a lot. And so that's one big barrier that one of our what physiotherapists have in Suriname, that the health insurance companies want to set the tone for our practice. And so I think now when I hear Stacy, her presentation, it's very relatable to Suriname. And I think we're going to bring in the trees and show the healthcare companies that insurance companies that we can bring in the trees and not the patients under the trees. So I just wanted to mention that, and that this was very inspiring to hear what can be done and what is being done, and that those small changes with plans can be of great benefit. So thank you very much for the presentations today.
Thanks for that perspective. And that's something that I've heard from Australian OTs as well, where they might be taking a patient to the beach or something, and then they've been questioned in terms of why can't a carer do that? Like, it's not your job. And I think it's about then selling what is it that we add value to. And I think Ella's presentation, her research is fantastic in terms of the approach that we can actually take that is more than just a parent can do without having been taught all those things, or more than a lot of carers would do. It is far more than just a trip to the forest. There's a lot more to it. And so I've actually got a question, Ella, for you, in terms of, you had fantastic results during the intervention phase, but then they dropped down again a little bit. I was wondering what your thoughts were on how to actually extend the benefits, or is it about trying to get parents or teachers or someone else to kind of keep that therapy going? What are your thoughts in terms of that maintenance phase?
Thanks, Jess. Doing the intervention in the forest was very challenging for me, especially with autistic children, that they might run away very fast to the forest, and then when and their mood also very unpredictable. For example, initially they were very calm and silent, but when they were in the forest, they became very active, and then they kept run to the forest, and then they even went to the ditch, and then they prefer to play around the ditch. So that was a very difficult situation that I really want to follow their interests, but they can be not safe for them. So in that moment, I and the teacher, the parents and the teacher accompanied the intervention procedure for the 12th intervention, but the parents they preferred to waiting in the pavilion, and the teacher helped us to record the intervention procedure, even though I also wore the GoPro camera with the chest mounting, but sometimes it didn't work. So they were really helpful, and the very fluctuation trend with Zoe, especially at that time, the parents really aware that afraid that Zoe might be doing tantrum or something. So they always gave her some candies every time Zoe didn't want to respond. And then the parents always follow Zoe and give them candies, so that I try to stop it, and I try to give some suggestion to stop giving her candy, and also bringing like beauty blender. Maybe you can see from the picture that Zoe always bring the beauty blender also for some participants at that time. So yeah, this is the challenges that I face up during the intervention.
Yeah, no, I think these interventions, particularly in a research context, are really, really challenging. So I think it's fantastic that you've done it. Philip?
I think, Stacey, you just had your hand up as well. Do you want to shoot in first? Yeah.
Just a very quick thing. It was based on something Sergio mentioned. I don't know how many of you experience it, because our medical formats vary from region to region, but in the Caribbean and in places like Suriname and Guyana that we consider Caribbean, even though they're based in South America, we have always had issues with insurance companies because they tend to dictate the pace with regards to reimbursement. And this was very evident during COVID, where we had to go into virtual mode, and that was very unheard of in the Caribbean for a large part of our for us as practitioners. And many in the early part of the pandemic, many health insurance companies did not reimburse physiotherapists for their services, but it had to be done. So it's just a reminder. And that has changed since then. Some of them continue to support us and reimburse for telehealth, but it's a reminder for us as physiotherapists, because we're very good at treating patients. I think as a profession, we're very poor at storytelling, telling our stories to the ears that need to hear it. And there needs to be, that continual advocacy for insurance companies and ministries of health, etc., to appreciate what we do. and know that, you know, physiotherapy happens anywhere, and we should be reimbursed for our services, and that health insurance companies should not be dictating our pace. So it just, you know, brought something to me, and COVID-19 showed that there's the possibility to change the hearts and minds of insurers. So this is just another complexion to this discussion about health insurance. And, you know, if we're bringing people out, why can't we reimburse? All we're doing is changing the environment. We're not changing our role. And what are they reimbursing us for? Our role, as opposed to where it's happening. So just wanted to add that. Thank you.
That's a really, really good point. Thank you. Philip?
Yeah, I mean, I also know this kind of problematic in Germany where some old rule determines that you're not supposed to take your patients outside of the stables of the clinic. Why ever they're using that term stables, I don't know. But essentially, I mean, it's a little bit absurd, because what you're then not allowed is, you're not allowed to take and treat your patients in their actual life worlds and environments, which includes nature, parks, you know, homes, etc., etc. It's an absurd situation. I recognize, Tasha, you probably have something on this in mind. I just want to try and express something that I've been wondering about. It's some kind of something between Tash and Ella. Tash, you've mentioned attention restoration theory. I don't know much or anything about it. I also heard Ella speak about joint attention, and I wonder if attention restoration theory, you know, if that was something, Ella, that also was helpful to you. It seems that in both cases there's kind of some this indication that, you know, outdoor nature-based something has an effect on attention. And then maybe, if I understood it right, attention also has some kind of relationship to mental health or something like that, you know, like how well, yeah. And so I'm just a little bit curious about that, because also one of the things that we've been talking about today a lot in different sessions is how nature-based health and therapy approaches in their various forms can have all these like surplus values beyond just, let's say, physical rehab parameters or something like that. And that seems to be one that was floating around between the two of you. So it's kind of an open question to both. Yeah.
Sure. Ella, do you want to comment on that, or do you want me to start?
You can start first.
So I think, from my understanding, actually, that's the first time I've heard of joint attention. And so that was actually really helpful for me to understand that aspect, Ellen. I thought you explained it really well. From my understanding, given I just heard about joint attention today, I think we're talking about different aspects, but in both cases, I think you hit the nail on the head, Philippe, that it's referring to that aspect of using differing environments, in this case, nature-based environments, to elicit effects on attention that might not otherwise be there. So using either that to pull people away from their daily life, which is what we might be trying to do within virtual reality. And it seems like with Ella's, it's almost to engage directly with that real life and pull the attention towards important things. One aspect, if I might just add on to Stacy, your comment about advocacy, I agree 100%. And I wonder sometimes whether we need to band together with some of the like associative learning psychologists and things, because there's such good evidence to suggest that when you're learning something, which I think that's what we're trying to do, we're trying to help people to learn, help people to adapt in all of these different cases, that doesn't generalize to new environments. Like sometimes it can, but you often have to take specific steps. So just because they can do something in a clinic setting doesn't mean that generalizes to a setting at home or a setting where there are differing barriers and other things. So I don't know. I think that you're right. I think we probably could be a bit more vocal, but also really pull in some of the other fields to just make that case. Like scientifically, this is what we should be doing, full stop.
Excellent point. Ella, did you want to respond to Philip's question?
Yeah, actually, attention restoration theory is one of the main theory I use in the theoretical framework, because sometimes the children, in particular autistic children, they do not communicate. It doesn't mean they do not want to communicate, but the barriers, and also they don't have enough opportunity to start and to respond the communication. So the key element in the nature is the resources provided by the nature, the attention, so that attention in joint attention is different. Joint attention is actually early social communication, how they start, how they build language, and then social communication, social interaction. It started by doing the attention, sharing interest and sharing affect about a situation that they interested in. So yeah, and I can see that the movement and the sounds of nature brought the happiness of the children, and this is a great opportunity for the teacher to come in, to get in, to train the target behaviors that they want to develop in the children.
Thanks, Ella. So we're a tiny bit over time, so we'll wrap things up. But if you're not a member of the association already, we'd encourage you to join. It is free and it is open to anyone, so you don't actually need to be a physio to join. So we'd encourage you to head across to the website, and that's where all these events and things get advertised as well. And the other thing we're doing at the moment is a survey of members and others who might be interested to work out whether we're on the right track in terms of the things we're providing, what else you'd like to be us to be doing, and things like, you know, best communication strategies, and if you actually want to be more involved in the association. So the survey link is there, and the QR code will also take you to that survey. We'll keep it open till the end of the year. But yeah, it'd be great just to get some feedback on making sure that we're doing what you actually need and want. So thank you all for coming today, and particularly for those who've been here for all the sessions, or at least some of the sessions. It's been great to get everyone together, and as we were talking about earlier, just to have that variety of presentations has been fantastic. So thank you, and no doubt we'll see you again in the future.